Good afternoon, everyone. Welcome to the 15th Annual Washington Leadership Academy. We're very glad you made it here safely, and on behalf of the HOSA International Executive Council and HOSA Inc. Board of Directors, we thank you for attending WLA and sharing this incredible experience with us. Directors, we thank you for attending WLA and sharing this place in coming together and truly celebrating what the core values of HOSA-Future health professionals is. As Roy T. Bennett once said, life is about accepting the challenges along the way and choosing to keep moving forward and savoring the journey. This quote holds great meaning as we are navigating through the challenges of the last 19 months. I hope you take both this quote and this year's theme, Shatter Your Expectations, to heart while you are here at WLA. It has been 2 years since we last gathered in Washington, D.C. The world has been through challenges, including the COVID-19 pandemic, equality struggles, and natural disasters. It is during these challenges that we focus and learn to be better global citizens and leaders. Our goal this week will be to look at our strengths and gain better insight of who we are as future health professionals. It is now time to take the next steps to shatter your expectations. This week, you will have the opportunity to learn not just from the leadership sessions, but also each other. You will have the chance to continue your HOSA story and propel your leadership development forward. As you walk the historic grounds of DC, explore the Smithsonian museums, and gain perspective from esteemed professionals on the public health panel, we hope you reflect on the experiences you have shared and apply the knowledge gained in order to enrich your chartered associations. During our time at WLA, I am ecstatic to be able to learn, lead, serve, and innovate alongside each and every single one of you. Now, to kick off this WLA, I'd like to introduce the 2021-2022 HOSA International Executive Council. This Executive Council member can chat for hours and hours about all things Carolina athletics, especially UNC basketball. Introducing your president-elect from North Carolina, Karthik Tyagi.
Give her some caffeine and she can talk for hours about health education, Taylor Swift, and her cats. Introducing your Central Region Vice President from Kansas, Hannah Eckstein.
You can find him performing cello repertoire or trying his luck on a skateboard. Introducing your Western Region Vice President from Texas, Tom Punnin.
He knows all things Tesla and flew a plane when he was just 9 years old. From New Jersey, your post-secondary collegiate vice president, Akash Kotian.
He's known for sipping tea, packing suitcases in record times, and talking about linguistics and friends. Your secondary board representative from Texas, Milad Ziai.
A ball girl at the International ATP Tennis Tournament in Cincinnati with a go-to guilty pleasure of dark chocolate-covered almonds. From Ohio, your post-secondary collegiate board representative, Alekia Kondragunta.
Whenever she gets the chance, you will find her writing letters and visiting her local farmers markets. Please welcome your Eastern Region Vice President from New Jersey, Angelina Yu.
And of course, we can't forget to bring it all back to our president, an avid investor by day and all things technology, video production, and dance by night. Please join me in welcoming Sricharan Pusala. So, ladies and gentlemen, this is your HOSA Executive Council for 2021 to 2022. Now, there's also a very special group of individuals that we would like to recognize. As a council and an organization, we want to thank you for all that you do each and every day. Will all state and local HOSA advisors please stand to be recognized? Thank you for all of your hard work and your continuous support of this organization. We truly would not be the tight-knit family we are today without each and every one of you.
One thing becomes clear. We would not be where we are today without HOSA's leadership. HOSA's leadership serves as the foundation of this organization and affords us all the opportunity to learn, lead, serve, and innovate as we forge forward into the future of healthcare. It would be an honor for you all to join me in welcoming members from the HOSA Inc. Board of Directors who are with us today. Please hold your applause until all have been introduced, and for our board members, please stand as your name is called. Marcus Henderson, Health Industry Board Representative, Medicine, Nursing, or Allied Health. Loretta Thompson, Eastern Region State Advisor. Heath Treadway, Allied Health Professional Alumni Representative. Sarah Sexton Walters, Secretary, and Mr. Jim Scott, Chair-elect.
At this time, I would like to welcome Dana Stringer, HOSA Inc. Board Chair and Alabama HOSA State Advisor, to the stage.
Thank you so much for that kind introduction, and welcome everybody to Washington, D.C. in person. One more time. I want to thank you all for being here, for going that extra mile to attend this Leadership Academy. I cannot thank the advisors enough. I cannot thank the officers enough and the members enough. We have gone through the most difficult 20 months that our healthcare profession has ever seen or has seen in any of our lifetimes. And the best way to shatter our expectations is to become the leaders that our healthcare profession needs. And you are taking those steps to become those leaders. You are going to take the skills that you learned here this week, and you're going to take them back to your chapter, and you're going to share these skills. And you are going to make sure that the future of healthcare is bright for the United States and abroad. Thank you so much for that. We are asking that you go back and you make sure that we encourage people to join HOSA, that we make sure they understand that HOSA is going to support them as they support HOSA, as we make sure that the future is bright for our healthcare profession. Thank you for allowing me to speak to you, and thank you again for attending, and please let any of us know if there's anything we can do to help or any questions we can answer. Thank you.
Thank you, Mrs. Stringer and the HOSA Inc. Board of Directors for supporting HOSA members and providing support to the Washington Leadership Academy. We would now like to introduce members from HOSA's management staff. Please save your applauses for the end. Mark Burley, Director of Leadership. Bobby Crandall, Director of Technology. Jeff Kinniger, Director. Laura Shepard, Senior Director. Karen Kinniger, Deputy Executive Director. And Dr. Jim Kinniger, Executive Director.
Our theme this year, Shatter Your Expectations, is a reminder for us to focus on dreaming big and never settling in pursuit of our aspirations. The health industry is always looking to the future when it comes to patient care, medicine, and rehabilitation. The industry is built on innovation and inspiring ideas from individuals with a passion for healthcare. Like everything else, reaching goals requires hard work and deliberate direction, which is why we are very excited to introduce you to our keynote speaker, one of HOSA's very own.
Marcus Henderson is a lecturer in the Department of Family and Community Health at the University of Pennsylvania School of Nursing, where he teaches undergraduate psychiatric and community health nursing. He holds a bachelor's and a master's of science in nursing from the University of Pennsylvania School of Nursing, and Marcus is also a PhD student at the Johns Hopkins University School of Nursing. Marcus has worked in both community-based and acute inpatient psychiatric settings. Previously, he served as the co-founder and the executive director of Up and Running Healthcare Solutions, a Philadelphia-based organization that provided case management for community health workers and other supportive services to homeless individuals. His work on health for homeless individuals and community health workers was funded by the 2017 President's Engagement Prize, and he was recognized as a community champion for positive change in 2018. Marcus has been involved with HOSA since 2009, starting as a student member, local chapter officer, state president, and alumnus. Marcus was a HOSA Public Health Leadership Scholar in 2016. He currently serves as the State Officer Coordinator for Pennsylvania HOSA and a Health Industry Board Representative on the HOSA Inc. Board of Directors. Please join me in welcoming Marcus Henderson.
Thank you, and good afternoon, everyone. It's a pleasure to be here and to be with you all this afternoon. Thank you to the HOSA Executive Council and the HOSA staff for the invitation to speak with all of you this afternoon. This is actually my first WLA, even though I've been in HOSA for some time, so I'm very excited to have my first in-person event to reinvigorate my passion for HOSA. And I'm here to share just a little bit with you about my HOSA story and how I got to be where I am today. And I think it's most fitting to start with the story of why I went into healthcare. At a very young age, when I was in middle school, I had the privilege and honor of my life to serve as the primary caregiver for my great-grandmother and my great-aunt, who both had Alzheimer's disease. And every day after school, I would go back to my grandmother's house where my great-grandmother and my great-aunt lived, and I would help them with their activities of daily living. I would give my grandmother a respite so she could then go out and do her activities and errands that she had to do. And naturally, if you're familiar with Alzheimer's, individuals begin to progress and decline cognitively, and it came to the point where our living room was actually a mini hospital. We had 2 hospital beds, oxygen machines, geriatric chairs, kangaroo pumps, which is a form of nutrition support from my aunt's G-tube. And I was in middle school and early high school doing bed baths, giving medications through a tube in my aunt's stomach. And throughout that whole time, I saw the power of healthcare, specifically the power of nurses, the home care nurses that would come into our house, the hospice nurses that would come in towards the end of their life to preserve their dignity. When we had to take them to the emergency room, the ER nurses and the nurses on the floors that used to provide such compassionate care for my family. And I was in my health-related technology program at Franklin Learning Center, so of course I thought I knew everything about healthcare. So I'm going to ask every provider when they walk in, what's going on? What procedure are you doing? Why are you doing that? It's not time for the medication yet, so why are you here at this time? So it was from that experience that I really started to develop a voice. So like I said, I entered high school and the health-related technology program at my school, and I joined HOSA. My HOSA advisor, Mrs. Way, introduced me to the program to begin developing those personal and leadership skills that all of you are developing and continue to develop on a daily basis. So I started the typical journey, join HOSA, go to a chapter meeting. What's the first thing you do? Pick a competitive event and study. So my first competitive event was medical reading. And medical reading morphed into epidemiology and getting very excited about the opportunity to enhance my skills and awareness and understanding of various topics through our competitive events program. I attended my first state leadership conference like many of you, and I had the opportunity to see the state officers on stage presenting, leading our organization into the future. I had the opportunity to meet my state advisor, who has retired but is now in another HOSA role. Mrs. Janet Nelson was my state advisor, who is still here supporting HOSA. And I remember going to my first state leadership conference and coming home and telling my advisor, like many of you probably did, I want to be like them. I want to be on that stage one day leading this organization. And that's what I did. I went home. The following year, I prepared to run for state leadership, run for state office. I went to the state leadership conference. I said, I just want to start off small. I'm going to be the Eastern Region Vice President. You go through the process. You interview with the delegates. The delegates come back. I go to the room where they release the slate, and they say, Marcus, you have been slated to the position of state president. Do you accept? Do I accept? Yes, I want to be on the state officer team, but I am not ready to escalate to that level. And this will tie in later about people seeing things in you that you don't necessarily see in yourself at a particular time. But someone saw something in me. Those executive council members, those delegates, the advisors that were mentoring them. And then I obviously accepted and was elected the state president of Pennsylvania. And from there, I had the privilege and honor of building my servant leadership skills, serving something of a higher purpose than me. Members like all of you who too joined HOSA to grow and develop themselves to become global leaders within their communities. So from that experience, being the state president, I came to, it was called National Leadership Council then, and now it's the International Leadership Council because we have grown and just shows the tremendous impact that HOSA continues to have. And I remember, like I said, going to my first NLC and saying, I want to be on stage like the HOSA Executive Council that are here today and running for the Executive Council. I wasn't elected to the Executive Council, but that was my first critical lesson in the importance of failure in not getting something that you set out to achieve. Because a lot of the times we sit back and say, we embody that failure, we think we're not good enough, and we don't push ourselves forward. But leaving that ILC in 2013 told me, not my time to support HOSA in that way, but there's other ways for me to continue my involvement and continue to grow as a leader. So graduated from high school, ended my time as a secondary member in HOSA, and became an active HOSA alumnus. When I started nursing school at the University of Pennsylvania, I knew from my HOSA experience that I wanted to continue my professional engagement, and I joined the Student Nurses Association of Pennsylvania, which is a member of the National Student Nurses Association, which is very similar to HOSA, just focused with nursing students. And I took those skills of teamwork, collaboration, leading teams, public speaking, communication, all of those things you're going to talk a lot about here as you're going through your various leadership sessions. And I began applying those skills to my leadership role now in nursing school. I would then go on to be actively involved, being on their state board of directors, and continuing to develop those leadership skills, because it's really a lifelong process and a lifelong journey, the leadership journey. So I go throughout nursing school, and I entered nursing school, and I said to myself, I'm going to be a geriatric nurse practitioner. My experience caring for my grandmother, caring for my great-aunt, really instilled a passion in me for caring for older adults. I got to nursing school, started my L&D rotation. Yes, I'm going to be an L&D nurse. Forget older adults. I'm going to take care of babies. I get into med-surg. Forget babies. I'm going to care for adults. I love this. So I was, if you're not catching on, I was that student that loved every rotation that I was in and didn't know exactly what I wanted to do. And then I got a position as a research assistant in our Center for Health Equity Research at the university, where I began learning about health equity and public health. Words today that mean a lot differently to me than they did when I was an undergraduate, because I didn't fully understand what that meant to be someone who's looking out for public health, population health. How is it the way we provide resources to different communities, the way that we decide how individuals, what treatment individuals receive? I did not understand the multi-level facets of what equity meant. But having that experience made me realize, okay, community health is something that I might be interested in, which is what HOSA focuses a lot on, building future global leaders, global health, public health, population health. So from that experience, I applied to the Public Health Leadership Scholars, had the opportunity to spend a week in DC in the Department of Health and Human Services, arrived at my community health rotation as a senior in nursing school, working with a school nurse in local public schools in Philadelphia, beginning to learn about how the public education system, our healthcare system, the child welfare system, all of these different sectors interact, influencing a child's life. And you heard about the President's Engagement Prize that I was fortunate to receive when I graduated from Penn. This prize was $100,000 given to a graduating senior to launch a social impact project at the local, state, or national level. My friend and I partnered together, because you'll learn that teamwork makes the dream work. We both knew that we wanted to impact the local Philadelphia community in a meaningful way. I was interested in working with at-risk children. He was interested in working with homeless adults. We came together for our collective passion in advancing health, reducing health disparities, and we developed a program called Homeless Health, Building Community Partnerships for a Healthier Future. We pitched our proposal, and 22 years old, given $100,000 to go do some good in the world. So imagine that, $100,000 to go launch a community health worker program that provided case management services to homeless men living in a shelter within Philadelphia. So my first job at a nursing school, and if any of you are interested in nursing, or some of the advisors here might be nurses, you probably have heard or remember being told, when you graduate nursing school, go work in med-surg, go work in the acute care environment, build your nursing skills, and then from there, pick the specialty you want to go in. And I took a very non-traditional route. I went into community public health right out of nursing school. And I'll never forget my first day in the shelter, walking in feeling like I wasn't a nurse. Even though I just spent 4 years in nursing school, sat for my boards, but I didn't feel like a nurse because I was always told that I needed to go get those skills somewhere else before I could begin doing the work that I really was passionate about and I loved. And then someone told me that I am a nurse because I'm the nurse of a community. I'm looking at things differently. I'm looking at about social determinants of health, social needs, how housing insecurity, food insecurity, income inequality, a broken, fragmented healthcare system, a broken, fragmented social services system. I was looking about how all of these things come together and impact an individual's life. And I went in with our community health workers to provide support to help them navigate all of these systems. So for 18 months, I've been saying honor and privilege a lot, but I am honored and privileged for the opportunities that I've had and the experiences I had and the people that I've met along the way and the people that have taught me, that have helped me to shape me into the nurse, the person, and leader that I am today. And for 18 months, we were able to work with over 200 homeless men to get nearly 40 of them successfully transitioned out of the shelter, connected with mental health and primary care services. We were able to provide group settings and health education for dozens more throughout that experience. And from from that time in the shelter, I began seeing so much unaddressed mental health issues that these homeless adult men were having. And that's what drew me into my current practice as a psychiatric mental health nurse. I wanted to understand more about the contributing factors to poor mental health. I wanted to understand more about how our broken healthcare system can be fixed. I wanted to understand more about how we can help individuals to achieve and maintain their most optimal health. So I chose to work with children and adolescents because I saw some hope in that working with young children, I could help to change their life course, change their trajectory while I was working with them in the inpatient setting. Quickly learned that that's not always the case when you're working in such a broken system. But the lessons that I was taught were some of the most valuable lessons are what is finding out what's wrong with a system, what's broken with a system, instead of going in and being defeated about it's not working the way it's supposed to work. So all of those experiences really were from my foundation in HOSA. HOSA's core values: learn, lead, serve, and innovate. The learning that I've had in my experiences at various different events with HOSA, the education that I received, my learning from the community that I worked with and that I learned from when I was a student and when I was practicing as a nurse in my first role. Leading, taking on leadership roles within the organization, and then recognizing that the skills I developed here translated to my leadership roles I could have in professional nursing organizations. And then the service, my commitment to always helping others and trying to make other people's lives better. Now, we didn't have the core values when I was a student, but those core values were always there. They just weren't fully identified. And that's the benefit we have now of the impact that those core values show and what we bring to the table when we are out there in our communities. So I do have some advice that I'd like to share with you from all of those experiences that I just shared with all of you. And one of the first things is discover your passions and your interests. Find out what it is that you love. Find out what it is that gets you excited and what drives you. Don't simply do what others want you to do or what others tell you to do, but do what it is that you love and are passionate about. It's your career. It's not anybody else's, and follow your heart. I think a lot of the times we respect our mentors so much that we try to fit into the mold that they're trying to create for us. And that's okay, but you shouldn't lose yourself in that process. So it's really important to find out what you care about, what your interests are, and really drive forward with that. And with that, it's about being curious and asking questions. Never stop asking questions, because curiosity drives innovation through new discoveries, the generation of new ideas and knowledge. And in the words of Walt Disney, we keep moving forward, opening new doors, and doing new things because we're curious. And curiosity keeps leading us down new paths. I spoke early in my story about the role of mentors and finding a mentor. Really finding multiple mentors, because there's not just that one person that is a one-size-fits-all for us and what we need. And the mentorship relationship, it's really a reciprocal process. And what I mean by that is that at the same time you're being mentored by somebody, you're also mentoring them in return. And that's what brings that stronger bond. You're teaching one another. You're learning from one another. You both bring lived experience to the table. You all have lived experience. Just because you might be early in your college undergraduate program, you might be in high school and your secondary education programs, you still have lived experience. And that's your expertise. And you need to own it, because that's what you bring with you every single day when you're in the classroom, in the community, in your job. So it's finding that mentor fit where you're both able to recognize that shared lived experience and that expertise and knowledge that you all bring to the table. It shouldn't be a one-directional process when you're finding your mentor and finding that bond. Capitalizing on your own strengths and weaknesses. You know, I heard you had to take a Cliff Finders assessment before you came here. That's something we do in graduate school. I remember in my second graduate course, we had to take a Cliff Finders assessment and understand more about where our strengths lie and what that means and what does that tell us and how we work as an individual and how we work within teams. So it's so important to understand what our strengths are and capitalize on our strengths and always continue building our strengths. But it's always also important to recognize that you'll always be strong in your strengths. And a lot of the times we seek comfort in only doing things that we feel good about or feel strong that we're able to excel in. And sometimes we forget about what areas of opportunity or weaknesses that we have underdeveloped that we don't focus on all the time. So as much as it is important to improve on your strengths, it's also equally important to acknowledge your weaknesses, because that's how you build the best team. You know, I don't want all 4 type A's who have the same strengths and everybody has the same areas of growth. So if we're all great public speakers, but none of us are great at operationalizing details, how are we going to move the work forward? So understanding your areas of growth or opportunity, you're able to develop a team where you complement one another. So I have an A, a B, a C, you know, any letter of the alphabet, whatever that means. That's how you build the strongest teams, where I complement your weaknesses and you complement mine, and we're able to grow and build together. And that's how we share responsibility, how we share accountability. Another, and I talked about this, is embracing failure. You know, it's okay not to be perfect. It's okay to fail. Failure allows us to have more self-awareness about what our strengths are, what our weaknesses are, so then when we eventually do succeed, we have a greater appreciation for it. And I was in high school, I was in college, I know how it feels not to get that perfect A on an assignment. I know how it feels not to get that fellowship that you applied for, that internship. I've had my fair share of failures and rejections. And I'm here to tell you that that's okay. Doesn't mean you're not good enough. It just means you need to work on some things a little bit. And that's okay. Nobody in this room that has a career of 10 or more years will not tell you that they haven't failed at something. And then that failure has led them to raise their own self-awareness, to push forward and move on. You know, I told you that I wasn't elected to the National Executive Council. That killed me. I was devastated. You know, how many people here have run for something and didn't? Well, you're all here, so you were elected, I guess. But maybe this is your second time running, and now you've achieved it. And it hurts, and you want to give up sometimes. And I will admit, I wanted to give up. I thought my HOSA journey was over because I couldn't achieve what I thought was that pinnacle moment of being on the HOSA Executive Council. But after some self-reflection and time, I recognized that my place was in the state. My place was giving back and becoming the state officer. I was the assistant state officer coordinator, and now I'm the state officer coordinator. My role was I wanted to make sure that generations after me reaped the same benefits that I've been able to have. And that led me to now serving on the HOSA Inc. Board of Directors because of my active role as alumnus and my career journey, being a nurse, being an active member of my professional associations. So it's just really important to embrace failure as a means of professional growth and development. And then my last piece of advice is to make a difference. And I know that's probably a cliche, and you probably hear it all the time, but I think it's always important to be reminded. And as Gandhi once said, we need to be the change that we wish to see in the world. And I used to use that quote a lot. But then I'm going to take it a step further because I heard the wise words of Amanda Gorman, our poet laureate from the inauguration this year, who told us towards the end of her poem, "There is always light if only we are brave enough to see it, if only we are brave enough to be it." And standing up here today helped me to realize that the future of healthcare is sitting right here in this room. Our board chair, Ms. Stringer, talked about that. Healthcare is at a pivotal time of change, constant evolution. The COVID-19 pandemic hasn't just exposed the fragmentation and the failures of our healthcare system, but it's exposed some of the greater issues within our society. And we, as future healthcare professionals, aren't going into our respective fields just to be the best nurse, the best physician, the best dentist, the best pharmacist, or whatever field you choose to go into. But we also have to recognize the space and place we hold within our institutions and within our communities to improve human condition. And recognizing that when that individual that you're caring for in the inpatient room, in the clinic, or wherever that might be, goes home to a community, and what does it mean for them living in that community? What does it mean for where they go to school? What does their social support and family support look like? You know, it's just so important that we see each other's common humanity, and I think that's one of the most important lessons of this COVID-19 pandemic, is seeing each other's common humanity. And you're probably asking, why am I going on this spiel about the importance of recognizing our space and place in community? Well, I'm going down that line of thinking because it was in HOSA where I developed those core skills of finding my voice, strengthening my voice, and then understanding how I can use my voice to amplify others. It was through my experiences in HOSA that I was confident in myself to be an advocate, to lead a team, to join projects, to be vocal and call my congressperson or call local leaders when we used to protest on campus for things that were happening around. It was my experiences in HOSA that build that confidence for me. So that's what I'm trying to instill with you today, is that take this is just the launching pad for your career. This is the critical foundation for the phenomenal things that all of you are going to do, whether that's here in the United States or globally. But HOSA is unique and it's powerful. And you would be surprised how many people still don't know what HOSA is. And it's our job to keep amplifying that message and telling people who we are, what we do, and what we're about. I was on a meeting the other day talking about the Future of Nursing 2020-2030 report. I didn't get into that because I didn't want to stand here and go through all of the things that I've done. But I was on that meeting, and the question came up about how do we diversify the pipeline? How do we ensure that our future health professionals are diverse? And whenever that comes up, I say, well, have you heard of HOSA? No, what's HOSA? Well, HOSA-Future Health Professionals is an international organization of students launching their healthcare careers. And more than half of our membership are from diverse backgrounds. We are the pipeline. So we need to spread that word, and we need to spread our message and encourage our local hospitals, our local healthcare leaders to really understand who we are and what we bring to the table. So I would charge each of you and you probably are charged by this at your state advisors, but go out and find those people and educate them about HOSA, because we are the pipeline that the profession is looking for. Schools of nursing, schools of any health profession school are looking for people like all of you who are already leaders during high school, during college, who are going to help transform the future of healthcare and health equity in this country. They're waiting for you to come knocking on their door. And HOSA provides you with the skills to be an advocate for yourselves and for others to provide those opportunities. Always think about today, you're trying to build yourself and your own career, but you're also trying to build those careers of everyone that comes behind us. So never lose sight of that. Always give back. Always remember your roots. And for me, my roots always come back to Penn HOSA, to HOSA, whenever I share my story. The future of healthcare is in this room. The future of healthcare is all of you. But it's only if you wish to see it. And it's only if you're brave enough to be it. So thank you all for the opportunity to speak with you and share a little bit about my story. and I wish you the most remarkable time here at the State Leadership Conference as you think about perhaps some of the things that I've shared, and think about all the things that you're learning and how you can then translate that to amplify yourselves and amplify those around you. So thank you.
Thank you, Marcus, for your inspirational words, helping us set the tone for the conference this week. Each of us in this room is inspired by your dedication and commitment to improving healthcare.
While we are here, our most important goal is your health and safety. We ask that at all times during indoor trainings and gatherings that masks are worn. We have assigned tables for your training sessions and will limit the number of members at each table to 5. Included in your registration packets was information on our bus protocol for tours. Buses have been assigned by wristband color, and we ask that you stay on that bus for all tours. In addition, all buffets will have to-go options for those who want to take your meals back to your room or outside. A tent with tables and chairs has been set up outside for your enjoyment.
We will have red, yellow, and green wristbands for everyone to attach to their lanyards to indicate your COVID comfort level. Green means you're okay with hugs and high fives. Yellow is if you're okay with talking but not touching. And lastly, red is if you want to keep your distance. Wristbands will be available outside Dogwood, HOSA's headquarter room, throughout the week if you need one now or you need a replacement. We also have several healthcare professionals with us this week that can assist you if you have any health concerns. If at any time during WLA you do not feel well or are exhibiting any COVID symptoms, please stay in your room and ask your advisor or chaperone to let us know. Our number one priority is keeping all of you safe, healthy, and happy.
As a friendly reminder, the leadership session will begin immediately following this session. For HOSA state officers, you will be in the Plaza A ballroom next door. For HOSA local leaders, you will be in the Magnolia on the lobby level. Local and state advisors will meet in the Arbors room on the lower level. Again, WLA welcomes you all, and we are very excited to have you here. Thank you.